So recovery after shoulder surgery, right? Managing pain and discomfort. There's a lot of ways to do this. I think, obviously on my end, I have some control there by doing the correct operation, right? Doing it in a minimally invasive way where there are things that you can do in surgery to make it less painful after surgery by making smaller incisions, using anchors that are smaller, taking away less bone, doing the procedure quickly. Like if you look at this, people tend to have less pain and recover quicker for a surgery that takes 20 to 30 minutes versus one that takes 2 to 3 hours, right? And I think that's common sense for a lot of people, but I've seen that. I've seen the people just hurt less, if we can get the surgery done in an efficient manner. We do a multimodal pain approach, right? So first up, we do a nerve block that's long acting for most of our shoulder surgeries, the last 2 or 3 days. And then we put you on maximum dose over-the-counter stuff. So 2 Tylenol, 4 ibuprofen, 3 times a day, if you can take it. And then we do doxycycline, which is an antibiotic that decreases inflammation. We do nerve medicines. And then we add in tramadol, which is like a lighter acting pain meds. And then we've got the big stuff, like the hydrocodones we typically use oxycodone. That's only if you need it, right? We also strongly encourage icing the shoulder 4 to 5 times a day. I strongly encourage an anti-inflammatory diet, okay? Which is, high protein, healthy fats, not a lot of simple carbohydrates, not a lot of processed foods, keep the alcohol to a minimum. Strongly encourage exercise, right? So people say, well, how am I going to exercise? I'm like, well, you got one good shoulder, work that one out. People are like, I don't want to be loppy or asymmetric. No, the data shows that if you keep your opposite side strong, this side will bounce back faster. So I tell people, listen, you got 3 wheels on this car that are functioning. Go run those 3 wheels. Let this one rest. We're going to work at PT, but work your legs, work your other shoulder. Get your endorphins flowing. Even if it's something as simple as getting on a Peloton, ride that Peloton. The endorphins that flow through your body from exercise are powerful pain relievers, very powerful. It's one of the reasons why people once you start exercising all the time, it's almost like you're addicted because you're addicted to that flow of adrenaline that comes and it decreases pain. So keep exercising. And if you are exercising all the time and then you have surgery and then you stop, it makes the surgical pain that much worse because you're stressed. You're not feeling good. And so exercise will help you heal faster, less stress, less pain. So exercise in any way possible. And then the therapist will help you with kind of gradually bringing you up to speed over the first couple months with surgery. We get people moving fast, way faster than most people that do shoulder surgery in terms of not wearing slings if they don't need them or if they don't want them, moving your arm quickly, and then trying to get that arm as fast as possible without doing anything to put risk at injuring you. What we've seen over the years is we can do way more than what's typically been acceptable within the shoulder surgery world without risking damaging the repairs. And actually what it does is it helps people get better faster.